Hi, I'm Dr. Neil Nandi. I'm an associate professor of clinical medicine and a Crohn's and ulcerative colitis specialist at the University of Pennsylvania. Today, I'll be speaking with an amazing IBD patient advocate, Tina Aswani Omprakash. We're going to be talking about her perspectives, her experiences as an IBD patient, and uniquely as a powerful IBD patient advocate. Tina, welcome.
Thank you so much for having me, Dr. Nandi. I really appreciate having these conversations with you as a leading gastroenterologist and being able to share my perspectives with the patient community.
Thank you, Tina. We're happy to have you here today. Can you tell me, I know I've gotten to learn a lot about you, but for our viewers today, can you please let us know, how did you come to your diagnosis of Crohn's, and when were you diagnosed?
Absolutely. So I was actually diagnosed in 2006 with ulcerative colitis. What led up to this was years of joint pain, eye issues, skin manifestations that hadn't been checked out, and I was dealing with IBS type symptoms, mixed IBS, going back and forth between diarrhea and constipation, as well as acid reflux, so GERD type symptoms, all throughout my childhood and into my teenage years and early adult years. Once I finally had health insurance and I started to work, at the age of 22, I decided to have this checked out, mainly because there's a history of inflammatory bowel disease in my family, and along with it, a history of colorectal cancer. As many of you might know, one of the major complications of inflammatory bowel disease, prolonged IBD really, is the development of potential colorectal cancer. So this is what had happened to my father and his sister, and they unfortunately passed away at pretty young ages from colorectal cancer. So at the age of 22, I went for my first colonoscopy, and at that point in time, I had rectosigmoid disease. So I had inflammation in my rectum and sigmoid, which is sort of the first part of the colon that leads up from the rectum, and so sort of from the bottom up. So I had mild inflammation, and it didn't look patchy or didn't look, quite the way that Crohn's disease does. So I was diagnosed with ulcerative colitis at the time. And that's sort of how I got my diagnosis and started on my journey with inflammatory bowel disease.
You have the family history, and so you had some insight. I wanted to ask, did you have that insight? Like, I don't want to assume, but for our patients, right? The formal diagnosis of your father and your aunt, right?
Yes.
And some patients out there may not have that benefit or insight, right? Or they wasn't educated to them. Can you tell us about how was that talked about in your family, in culturally, socially? Was that something open?
That's a great question. I'm so glad that you're asking me about that. To be honest with you, my father passed away when I was 8 years old. So this was very hush-hush in my family, and my aunt passed away when I was 11, and that too in New Delhi, India. My family is of South Asian descent, and this is not something we commonly discuss within our culture and within our community. Because it is also very stigmatized as a bowel condition, we don't really talk about these things, especially when it involves like bloody stools or stomach upset, something that really to most people is considered unpleasant, similar to American culture as well. This is not something we like to talk about, poop or using the bathroom. But there is this additional layer of stigma that we have to deal with, being of a racial and ethnic minority group. In my culture specifically, what we're dealing with is the stigma around this is less than perfect. This is not an acceptable thing to really talk about. We talk about, our achievements and our successes. We tend to hide anything that's less than sort of that role of perfection. So this is something that I really struggled with at the age of 22. I didn't have anybody to talk to about it. While I did know what inflammatory bowel disease was because my father had it and my aunt did as well, it was not something back then that I could just Google and learn more about. Also, it was one of those things, because it was so stigmatized, I was encouraged to keep it to myself and really not disclose my diagnosis to anyone, because there were a lot of fears around, okay, you're a young woman, Tina, who's going to marry you with a condition like this? On paper, everything else about you adds up, meaning your grades, your Wall Street career, everything else added up about me. It was this big sort of quote unquote flaw of having ulcerative colitis, which was my diagnosis at this time, that was considered not something that was worth sharing. So Dr. Nandi, to answer your question, this was very, very difficult. I did not share. I did not really have much support at the time, even though there was this family history of inflammatory bowel disease.
Yeah, and that was my concern, that, even if you have some insight that this exists, that it may not be talked about, and not just in South Asian cultures, but many ethnic, cultures, don't talk about the bathroom experience or those GI illnesses, unfortunately. So again, this is all the more important why, if you may not be blessed to have that kind of family or support structure, you deserve that kind of relationship with your doctor, right?
Absolutely, 100%. And I know you understand that, given your experiences with different racial and ethnic minorities in your own background. So it's really, really important to be able to have an important, this open discussion with your doctor about how is sort of my culture or my background affecting not only my diagnosis, but the support that I'm receiving as a result of that.
Absolutely. So tell me, when you first, met your doctor, you said at 22 you had your first colonoscopy, and then you met your doc, and they started, unfolding, right, this diagnosis to you. What was that first experience like? What was how did they explain it to you? Did they feel like they were empowering you? Did they educate you? Did they explain, what to expect, what the course of IBD would be for you?
That's a great question. And, I have to sort of backtrack and say, when I was first diagnosed, I was actually not told. And I had a colonoscopy. I woke up. I was not told that I had this diagnosis because it was so mild. So I was not even put on medication, and I wasn't even encouraged to have a follow-up. Mind you, this was 2006. So just about 14 years ago, almost 15 years. And no one had discussed it with me. So I thought I was fine, that, I had this colonoscopy and it went okay. Over the next 5 months, however, I developed symptoms. By symptoms, I mean bloody diarrhea. And I was anemic. I could feel myself losing a lot of weight. There was a day when I was going to work and I nearly fell on the street and passed out. I was rushed to the hospital that day. The same doctor did a colonoscopy and said, look, you have this disease. It's gotten worse. I'm like, wait a second. This was never even discussed with me. Now I realize this is a bit outside the norm, that this should have been disclosed to me, but it wasn't. At that point in time, I was like, okay, Tina, now you really need to sort of get on the ball. You do have this disease. So it was this process of sort of empowering myself. Once I got out of the hospital, I requested all the medical records, found myself a brand new doctor based on recommendations in New York City. He sat down with me, redid a lot of my testing, went over all the aspects of ulcerative colitis, why he thinks this is ulcerative colitis and not Crohn's at the time. He went over the imaging, showed it to me clearly, explained all the details around what it means to have ulcerative colitis, what role diet plays, what role medication plays, and he put me on a suitable medication to try to get my disease better controlled at that point in time. And I'm so glad that I did that, because sometimes patients struggle to get a second opinion or struggle to change physicians, but it's really, really important to recognize when you need to do so.
Tina, it was really unfortunate that that happened. But the way you described that, having a physician who will disclose this to you, I always ask myself, why would they not talk to you about it? And it makes me think, for patients to realize that IBD may not be the strength of your doctor. That's not an excuse not to disclose information, of course, but you have to know that now more than ever, gastroenterologists are subspecializing. Some doctors are reflux doctors, and some doctors are liver doctors, and some, like myself, my colleagues, are IBD specialists. And so, Tina, you went out there and you said, I'm not feeling the vibe. I'm not getting the education I need. I'm not getting the understanding I need out of my doctor. So let me get a second opinion. And there's nothing wrong with that. It's nothing wrong with getting a second opinion. And I'm glad that you found a second opinion and you found a doctor who was going to sit down and make sure that they educated you and explained your results, because they're about your body, right? So if you're a patient listening to this, it's not wrong to get a second opinion, and you can expect more, okay? You can expect more from your physician. That's what I would say.
Absolutely. And I think that's such an important point to make sure. And this is something that I tell patients all the time, because it's something that I learned from my own experiences. When you get a diagnosis like IBD, it's very important to sort of seek that IBD specialist's care. In the beginning, it might be fine to see a general gastroenterologist, but down the line, I think it's very, very important to make sure that you have an IBDologist like yourself on board who can really understand the intricacies of this disease and how to get patients on advanced therapies or how to move them into surgery if that's what's needed at the time.
Absolutely. So let me ask you, how did did you or your doctor, when you started having that session, the second opinion, and they started explaining the illness, did they discuss setting the expectations of your treatment? Like, what were the goals? How did they do that?
Absolutely. So at that time, I was mainly put on 5 ASAs, which is sort of the lower rung of treatments as far as mild ulcerative colitis goes. And he had explained to me how this would work, how it would sort of line my intestines to prevent sort of damage when I'd be eating or with pooping. And because my disease was mainly rectosigmoid at that time and towards the bottom, I tended to need a lot of enemas and suppositories. So I was taking them at night and then again in the morning to make sure that I could get through the day and get through working. One of the things that he did make sure was being able to go to work, being able to eat the foods that I want, stress levels, we talked about that as well, and just making sure that we keep those goals for continuing to work through this, because it's really easy for us as patients to develop so much fatigue, so much pain with this condition that it's difficult to work during periods of flare-up. So we talked about, what sort of goals are important to me. And at the time it was work and the graduate program that I was in. So we talked about how to keep up with my medication to make sure that I could fulfill these goals. So yeah, there was goal setting. There was making sure that I understood the medication. There was also additional testing done because he wanted to rule out Crohn's, because that's what I had mainly going on in my family. So I was undergoing capsule endoscopy, small bowel series, things like that, just to make sure that there wasn't any Crohn's anywhere else. And so he landed upon the ulcerative colitis diagnosis as well after further investigation. So he did explain all of that to me. The thing that was not explained to me, and perhaps this was a stylistic difference back then, being that it was 14, 15 years ago, was the progressive nature of IBD. That was not something that I had much understanding about, given that I was so young when my father passed. I mean, I understood that this could be a very serious disease. I just didn't know at my age at the time what that really looked like. And I think it's very hard for patients to sort of visualize how a disease can get very serious. So that was not quite explained to me. Also, what was not sort of understood by me at the time, and I wish I had better preparation for it, was what are advanced therapies, what are sort of the surgeries for IBD. And I realized I was very mild at the time, but it is something that I think patients need to be prepared for, prepared to really understand, okay, so what does the progression of this disease look like, and what sort of medications are used to treat that progression, and where does colorectal surgery really get involved? So that was the one thing I think I wish would have been better explained to me, is sort of, not everybody gets severe, I understand that, but sort of that progression of disease and what that might look like, so that I could wrap my head around it a little bit better.
Yeah. I have two takeaways as I'm listening to you intently, which is, one, I really like your doctor at that time, where he placed you on medicines and reviewed, what was important to you, kind of like what I was saying in the beginning, right? For you, it was graduate school at the time, right? And showing you that, or trying to emphasize to you that adherence to the medicines, taking them, not because you have to, but because it gives you the ability, right, to lessen symptoms so you can fulfill your graduate school, your objective, right? So that was, I think, a good example, right? So where patients are forthright, a patient speaks up, right, about this is important to me. This is what I need to be able to do to be happy. I want my gut happy so I can do X, Y, or Z.
Exactly.
I really like that. And the second thing that I think you're absolutely right. We need to do a better job explaining what to expect, like the long-term progression. So if you're a doc or a healthcare provider listening to this, I know what's going on through your mind. One thing has to be, how much time do I have in clinic, right? I mean, do I have enough resources to do this? And that's exactly why I think, Tina, you and I are proud to help develop this program that we have, right? Because it is a resource, right? It's something that, clinicians and patients can share and use and reference, right, outside the confines of the clinic clock or the clinic wall, right? Something you can do on your own time, like tried, trusted, true information. So you're right. And that's where we can talk more about progression. We should certainly do it in the clinic, but provide resources like this where patients can go and review the information.
I 100% agree. And the one thing that I would just want to add is, I think having services like gastropsychology available in the clinic for when doctors are unable to spend, this length of time with their patients to have them understand all these details. I think a psychologist's role could be around accepting the disease, but also accepting the progressive nature of this disease, right? So I think that's where perhaps psychology can also have a role.
100%. Yeah, absolutely. There's, definitely most chronic illnesses, ulcerative colitis being no exception, have an increased comorbid rate of anxiety and depression for obvious reasons, right? Obvious reasons, right? And there's no shame in that, but we definitely don't have enough gut or GI themed psychologists, right? Niche focused psychologists to help. But we definitely need more mental health access for our patients. Let me ask you, what were the things that helped you have an open dialogue with your doc? Tina, what I like about you, how I know you, one of the things I love about you actually, is that you're upfront and direct. I don't see a lot of BS, which I love, okay? But not everybody's like that. What kinds of things helped you have an honest, open dialogue with your doctor, and what kind of things did your doctor do or portray or imbue that helped you feel confident to have that dialogue with them?
That's a fantastic question. And I think that's where it's important to emphasize the journey aspect of being an inflammatory bowel disease patient. When I was 22, 23 and first diagnosed with this, it was really hard for me to share and talk about this. Oh my God, I'm going in with this pooping disease is what I was thinking about. And, not to laugh about it, but it was just like, oh my God, how do I talk to my doctor about this? How do I share my symptoms? And I think over the years, because of this disease, I've actually become more upfront and direct. It just is what it is. And I need to get better quality of life. So I have seen over the years this progression within myself of, okay, Tina, we need to focus on how to get you better. And it's this sort of dialogue that I'm having with myself is, forget the shame, put aside that, there's bathroom issues here, or there's blood coming out of places you never imagined blood coming out of. Put all of that aside. What is going to make you better? And I think that's what really allowed me to come into my own and really have that open, honest dialogue with my doctor. Even if I felt like my doctor, didn't want to sort of get into the nitty gritty. Like when I developed something called fistulas, or when I developed, more and more complications with my disease, with my J pouch or with my ostomy, it became sort of very hard for me to bring some of these topics up, even like when I wanted to talk to my doctors about intercourse, especially with having active disease or after having surgery or after having a major flare-up. These were very difficult conversations for me to have. But I think over time, I became more comfortable because I was like, you know what, Tina, you deserve to have a life. You deserve to have a life that you want to live, and you're going to have to ask these questions. Even if your doctor does not want to approach these topics, you need to approach them. And I know for a lot of patients, this is very difficult, so I want to emphasize this for patients and clinicians alike. We want to have these conversations. It's really difficult to sort of speak about this, and we muster up a lot of courage when we come into the doctor's office, wanting to ask these questions. Sometimes we don't have the courage to do it. There were times when I would ask my surgeon's nurse the question because I felt a little bit more comfortable, or where I would send the question through the portal. That's not the right way. The right way is to open up and have the conversation. They're more than likely going to be willing to talk to you about it and to help you through this process. And I think if they're going to take care of you and really understand you as a patient and have that open doctor-patient relationship, it's really important to open up about these things for them to understand what kind of quality of life you're looking for, and that you just want to do with your life what everyone else your age wants to do. So that's kind of how I've gotten to this place where I'm upfront, honest, and direct. I think it's really important for patients to do that, especially with this disease. Otherwise, it's very difficult to achieve the quality of life and achieve the goals that we want to achieve in our lives and in our relationships.
Yeah. Yeah, no, I think like you said, it's a journey, it's a progression, and I think as a patient, it takes time to muster up that courage. But in the end, like you said, you have to own your disease, and you have to own, the team, right? The team is supposed to be a patient-centered team where you're the captain of the ship and we work for you. Exactly. And, something I like is, I'm a doctor, but I cannot take an amazing care of my IBD patients alone. I rely on a team of people who help me take care of my patients. So that includes other physicians like a colorectal surgeon or my own GI colleagues when I'm maybe away, but also my PA is amazing. My nurses are unbelievable. My interstomal care therapy people are amazing. I have wonderful dietitians I get to work with, and I'm lucky. I have a couple of GI psychologists I work with too. And there's more, right? But it's a whole team-based approach. You just mentioned that you felt more open actually talking to your nurse about certain things. And I want to remind clinicians that, look, not all my patients, love talking to Dr. Nandi about everything, right? I have to work for it, right? But it's important that as a doc, recognize that different members of my team are integral to the delivery of care, to relaying information, and also getting information, right, of being of service. And I think that's what's another fun part of IBD care for me, is that it is team-based care. It's a team-based approach, and we all work together.
Absolutely. It takes a village, like they say, especially in some of the more severe, complex cases. It's really important, and I think patients need to understand that as well. There is the doctor-patient relationship, but there is a whole IBD care team relationship as well that we need to consider and that we need to utilize as well. And so if, like you said, if my doctor's on vacation or away or what have you, be open to having that conversation with the PA or nurse. Be open to working with, another physician within the practice, but also be open to working with the dietitian, the psychologist, if available to you, as well as the entire staff, just to make sure you're able to get your medications, that you're able to get yourself the care that you need.
You just talked something important about, being open to those things. And again, the patients have to muster up the courage. Are there any specific concrete examples or tips really about how patients can make themselves feel empowered or, rise up out of their shell, perhaps? Anything that you might recommend that they do in advance of a visit or during a visit to bring up their actual needs?
So a few things that I do. One of the things that I do is I always write a list the night before of, things that have been on my mind, things that are going on with me health-wise that I don't want to forget to bring up. And also I do a lot of reading about, my condition and try to understand some of the comorbidities, but also some of the extra intestinal manifestations. So some of the skin or joint or eye issues that I might be having, just to make sure that I'm checking in with my GI to make sure that, my IBD is still under control if I'm having all these other things go haywire. But also, given that I have other comorbidities or diseases, I often want to check with my doctor about the different medications that I'm on and if they're having GI side effects or if I should even start this. So it's like I was saying earlier, it really takes a village. It often involves not even the gastroenterology specialty, but other specialties as well, like dermatology or rheumatology or ophthalmology, even hepatology, to sort of get certain other aspects of the disease under control and making sure that there's communication lines open between different physicians and different offices. So that's one thing I think patients might have to facilitate in that process, is that communication and making sure that we're asking all these questions of our providers to make sure we're getting the best care for ourselves. So that's one thing that I do. The other thing is I think the psychosocial aspect of this disease is extremely important. As you said earlier, there's a lot of mental health, anxiety, and specifically depression type comorbidities with inflammatory bowel disease, which is completely natural. It's a really tough disease that hits at a very young age most times, and it can get very alienating and isolating and difficult for us. So one of the things that I've done from the very beginning, and my mother was really instrumental in doing this, which I have to laud her for, given the cultural stigmas around psychotherapy in my culture. She actually put me in psychotherapy once I flared up pretty badly. And she's like, Tina, I think we're going to have to manage this because you've had to pull out of work, you've had to pull out of school, and you've had to leave your life in New York City and come home to New Jersey to have me help take care of you. So I think we need to get a therapist on board. That helped me immensely, and I think that helped to, it's taken years, but it's helped to rebuild my confidence even with a chronic illness like inflammatory bowel disease. But in addition to that, the other instrumental thing that my mom had done during this time is make sure that I attend support groups. I didn't necessarily feel comfortable speaking up there, but she's like, you need other people like you. I think because she had seen what had happened to my father with the psychosocial aspects of this disease and how much he had closed off, having this diagnosis, she didn't want me to become isolated. So she would often take me to the hospital support groups or even the Crohn's and Colitis Foundation support groups to make sure that I was meeting other people like myself. And even when I got an ostomy support groups, to make sure that, I didn't feel alone, that I had somewhere to talk. And if I didn't feel comfortable talking, that I could at least take in what the others were saying so that I could feel like I had an inclusive space. So I think these are some of the things that have really helped me throughout my journey, not just with coping, but also preparing for a variety of appointments, when you go to these support groups or when you see a therapist, you can sort of even strategize with them or understand from them the different aspects of this disease. You get education at these support groups or even from your therapist about how you can sort of approach certain topics with your doctor when you might not feel comfortable talking about certain aspects of your disease. So I think all of these things have really come together to feel like they've very much empowered me. Back when I was going through some of my roughest times, there wasn't social media and there wasn't this presence of patient advocates quite the way that there is now. So it was very difficult to sort of know who to reach out to online. But now, being a patient advocate, I'm seeing, and every day I'm hearing from patients from around the world who are really, really struggling, whether it's on a psychosocial basis, whether it's how do I have those conversations with my doctor or my doctor's not answering this question, how do I deal with this or how do I deal with the side effect, those types of things. Like I hear from patients daily, and I think the value of online support has grown exponentially, and we cannot emphasize that enough as well. And I think that's been an extremely empowering space for a lot of patients who are newly diagnosed, and forget even newly diagnosed, patients who are going through and trying new therapies or needing to undergo surgeries or trying to understand, should they try this therapy versus another one? How should they talk to their doctor about this? Do they want to undergo surgery right now? Or do they want to keep the ostomy right now? Or do they want to move forward with the J-pouch? There's so many questions, so many closed groups where patients are discussing different topics, getting education. Is there misinformation? At times there is, like Dr. Nandi was saying earlier, but I think that's where the value of strong patient advocates comes in. Patients who have lived and experienced this disease, but also have the knowledge to back up the understanding around this disease and sort of help to empower patients to speak to their doctors to get clarity and good information. So I think a culmination of all these things is where patient empowerment can really come from.
So Tina, thank you so much for sharing, a lot of intimate details about your personal life and, the progression of your illness and your interaction with the healthcare experience. I think that, you and I, this conversation serves hopefully as a jumping point for anybody listening here about how can we improve ourselves as clinicians so that our patients can talk to us? How can we better understand their needs? Because by doing so as a clinician, it actually makes care easier. The educated patient is someone vested in their care who's going to be compliant, adherent, and have a good outcome. And for patients, it's important to understand that you need to speak up. You deserve to speak up, and you deserve a clinical team, an IBD care team that wants to listen to you. And it's important that we also understand that all the education should focus around the clinic, but it can't occur there alone. So you have to have trusted, good educational resources, and that's why we're very happy and proud to go ahead and sponsor and develop the project that we're here now developing with Girls with Guts and the Academy on this type of a resource so you can have good information that you can review on your own time. So again, Tina, thanks so much. We really appreciate it. And to all you out there, thank you as well.